So how do we revascularize? So I hope these pictures, visual effects will explain it to you. Let's focus on this first one on the top left. This is a cholesterol buildup, and this here is a normal artery. Blood is flowing down this way. So we can do, if you look at the top right, if you look at this, there is a wire in there and there's a balloon on it. We place it strategically and then expand the balloon and squish the cholesterol plaque into the wall. But if we do this, this is called plain old balloon angioplasty. This is what we used to do years ago. We still do it in some cases, but then the artery has a tendency to regrow the cholesterol plaque and also to collapse. So now if you look at the bottom left of the screen, this is a stent. So it's on a balloon, on a wire, we expand it, the stent is deployed, everything is pulled out, and the stent is left back. And this stent actually has a drug, and it elutes the drug constantly so that over here, these cells do not proliferate again. They are basically drugs which treat cancer, so they are anti-proliferation. So if you put a drug-eluting stent, the chances of restenosis, which is closure, is very small. It's less than 1%. So these are really very good. So we do this if the blockage is in one spot or two spots, or it's something that we can do from a percutaneous procedure. If the blockage is too complicated or there are too many blockages, then we revascularize with bypass. So look at the right bottom. Over here, it's a beating heart, and these red ones are the arteries. Let's say the blockage is here, up here. We add this vein, take it from the leg and plant it here. So we are basically bypassing the blockage. So in layman's term, if there is a highway and the road is blocked, the CHP comes and creates a detour and bypasses that blockage. That's pretty much what we are doing here. So the bypass is here, the blockage is here, and we are bypassing it. I hope that was clear in this illustration. So if you look at this, this is the angioplasty, the same thing that I showed you over here. You will see in the cardiac cath lab, here is the blockage. If you look at the top left, that's the angiogram, and you can see the blockage right there in the middle where the artery looks like it's been eaten away. And then if you look at the bottom right, the stent was expanded, the stent was expanded, and it's now nice and open, right? That's percutaneous coronary intervention. Now, once we do these interventions, we wait for a few weeks to make sure that the heart muscle, which, it was contracting like this, suddenly over here, the artery got compromised. So this wall, instead of moving like this, now lags behind. Think about this. You're running a race, and I take a tourniquet and I tie it tight on your thigh on the right side. Now, when you run, that right leg will lag behind. And if I tie both your legs, you will be the last one in the race if you run at all, because the legs will be so weak because there's no blood supply. Once you open the blood supply, take out the tourniquet that you have tied, the legs get circulation, and then they can run again. Similarly, when the heart has become weak because of decreased blood supply, once you do the angioplasty, once you do the bypass, whichever intervention you have done, we give the muscle time to see if it will come back. If it comes back, you have treated it and the heart has become all right and the pumping is normal. Bypass is very good for multiple vessels and multiple vessels in diabetics. Longevity of life and readmissions are much less with bypass. So it depends, the choice of the procedure depends on the patient selection, patient's criteria. Let's say the patient gets better, then you treat them with medication and lifestyle changes. Very, very important. Therapeutic lifestyle changes.